We incorporate strength testing as a core component of our programs here at Progressive Sports Medicine. This helps us to understand baseline measurements such as force production, injury risk, and overall physical function. Muscle mass and bone mass act as longevity capital, a reserve that really helps to protect function, independence, and quality of life as we age. The goal of strength testing is to quantify how much force an individual can produce across key movement patterns. We know there is a strong link between higher levels of force production and greater muscle mass. This is also closely related to bone mass, as greater mechanical loading through muscle contraction increases the strain on the bone, which therefore will stimulate osteoblast activity and bone remodeling, leading to improvements in bone mineral density over time. The goal of strength testing and strength training at our clinic really is to optimize this curve. It's to slow down the age-related decline in muscle and bone mass and really help individuals maintain strength, function, and independence for as long as possible. As we age, we experience what is known as anabolic resistance, an age-related reduction in the ability of muscle to build protein in response to exercise and dietary protein. This is largely influenced by impaired cellular signaling within the muscle, increased insulin resistance, and other age-related physiological changes. Importantly, anabolic resistance can be mitigated through adequate protein intake and consistent progressive resistance training. For women, hormone replacement therapy during menopause can play an important role in helping to protect bone mineral density, as well as supporting mood, motivation, which can indirectly improve engagement with strength training. This, alongside resistance training, allows greater force to be applied to muscle and bone, supporting improvements in total bone mass, total muscle mass, bone density, and overall strength. Decisions around HRT really should be made in consultation with a medical practitioner or your GP. A key aim of our approach is to reduce the risk of age-related sarcopenia, the progressive loss of muscle mass and strength that is associated with frailty, loss of independence, increased falls risks, and increased fracture risks. By building a substantial reserve of muscle mass and strength earlier in life, individuals can slow down the decline and improve their overall health and quality of life. If preserving lean muscle mass is central to longevity, this becomes very clear when we compare two 70-year-old men. In the top image, we see a 70-year-old triathlete, significant lean muscle mass in his lower limb. In contrast, the bottom image shows a sedentary 70-year-old man with high levels of adipose tissue or fat in the legs, fat infiltration within the skeletal muscle mass, and the difference in physical capacity between these two individuals will be so dramatic. The triathlete with high muscle mass, low fat mass, is able to cycle, swim, and run at a high level. Meanwhile, the sedentary individual is more likely to experience frailty, higher risk of cardiovascular and metabolic disease, poorer quality of life, and difficulty performing activities of daily living. But we use grip strength as our primary upper body measure of overall strength and functional capacity. It's a well-researched, easy to administer, and highly reliable test that strongly correlates with health outcomes and mortality. Individuals in the highest quartile of grip strength have been shown to have approximately 20 to 30% lower risk of all-cause mortality compared to the lowest quartile. Really, our aim is to establish an evidence-based baseline and then implement targeted training interventions to improve your strength over time. And in the clinic, we use the VALD equipment, a validated and calibrated handheld dynamometer, which allows us to obtain accurate measurements and track progress over time. We also assess lower body strength through a knee extension strength test. This is performed while seated with the knee at approximately 90 degrees, where the individual will attempt to extend the knee against a fixed resistance. This provides a reliable measurement of quadriceps strength, which is a key indicator of overall lower body strength, functional capacity, and injury resilience.
This content is provided for general educational purposes only. It is not medical advice, does not replace consultation with a patient's own doctor, and should not be used to make individual health decisions. Nothing in this presentation is intended to bypass or replace the role of general practitioners or established screening programs. No patient-doctor relationship is created by viewing this content. If a patient has symptoms or concerns or abnormal results, they should seek prompt assessment from their GP or treating specialist.